people have been having more stress, but one of the other impacts is that people also haven't necessarily been seeking care for any of their health issues. Maybe they haven't seen their primary care doctor, or they just feel like they may not want to attend the hospital. And so what we're seeing both in community mental health, and I'm sure Dr. Lau at the hospital, is that people are coming in after waiting far too long to seek care. And there's people, have much more serious problems. And so one of the things that we're really trying to tell people is, get out there if you have concerns and see your doctor early. Dr. Lau.
Yeah, no, for sure. There is an issue of access that is, the cancer screenings, for instance, that has been a huge issue that people have identified, because people are in the first year, especially, people stopped going to their doctors and they were afraid. So that had a huge impact on access. And in the area of mental health, it in some ways has been a mixed bag, because I've had patients who've come to the hospital that because of anxiety, they would not be able to. So the technology for those that have access to it helped. But for most people, they don't have, a lot of our patients don't have the means to have to use technology to come in. So access has by and large been worse, but there have been some innovations as a result of technology. So those are serious things that have happened with the pandemic. And I know people are under a lot of stress, including the healthcare providers.
Yes.
And it comes out in different ways. And I think the thing that you were talking about, having it out in the open and the importance of it, because if you can't put a name to the stress, it takes a life of its own.
If I can add, it's really important to also understand that those with the more serious issues are faring worse. We've seen a huge rise and lack of access for young women or young people with eating disorders,
right,
which has been identified by the province as a huge issue. People are now who need both medical and mental health care are having to wait or can't even get into inpatient services. For people with substance use issues, we've had a radical increase in opioid deaths. And we recently saw in the newspaper Indigenous communities that have had a staggering amount. And so again, those who are more acute have really fared worse because of some of these access issues. But I agree, for those of us, particularly when we get into areas where people can seek support, the way that we can help people through virtual care and the fact that we're reopening up has been huge in terms of, people that are managing or people who see that their family members are struggling can get much better access right from the ease of their home. And so that's a real positive thing that's come out.
Now, I know, Rebecca, when we chatted, I guess it was about a year ago, just a few months after we started COVID, maybe it was in September, we saw some of these statistics about the eating disorders, about, the rise in youth suicide and the rise in mental health diagnoses. And I know the mental health practitioners and the care community really had to pivot quickly. It was very hard during that first lockdown, but by the second and maybe third lockdown, we improved. So I guess I'm going to ask a question. Nearly 2 years later, is care providing better or worse than when we were at the onset of this crisis?
My comment is, and I'm sure Dr. Lau will have something different, is that there's a range of care that people need. And when you talk about really serious people who are highly symptomatic in an acute phase, like an eating disorder, they both need hospital care because, of course, they're medically fragile, and then they need ongoing support. And so a virtual session isn't going to cut it. Right. People with significant substance abuse issues, where they can have an overdose, virtual care isn't going to cut it, even though there's been some incredible innovations like safe lines where they can use with somebody on the other end of the phone. But you're talking about people with real challenges that have been isolated. When we look at, other sort of key, I think, acute illnesses like schizophrenia or psychosis disorder, a lot of those folks need inpatient or They need face-to-face care. So we're doing that work. And we're adding virtual care. So I think we've had great innovations and great expansions, particularly in the areas of anxiety and depression.